cooperation and collaboration that we have with county governments, especially those who have confirmed COVID-19 cases, and urge the rest of the counties to continue upscaling the level of preparedness and vigilance. As we mentioned yesterday, we would like to reiterate that all persons visiting public places such as supermarkets, open-air markets, public transport should at all times wear a face mask to reduce the chances of transmission of this virus. The production of face masks and other healthcare-related equipment is ongoing locally. The distribution of the masks will be done at the county level through various organized groups such as the Matatu Circles. Meanwhile, I urge you to continue to acquire masks as we await for the government distribution. Fellow Kenyans, it has also come to our attention that there are private hospitals who are overcharging Kenyans and taking opportunity of this pandemic. We have reports of gloves and other PPE equipment that are costing about 8,000 Kenya shillings for Kenyans who are admitted in facilities. This is unacceptable and immoral, and the Medical Council has been directed to take up this issue. At this juncture, I'd like to invite the Cabinet Secretary of Transport to give you further updates.
Thank you very much, CAS Dr. Mercy Mwangangi. Fellow Kenyans, as you may recall, the government suspended international flights for a period of 2 weeks from Wednesday, 25th March 2020, which expires today at midnight. After serious consideration of the situation, the government has extended the ban for another 30 days with effect from tomorrow, 6th April 2020. This suspension will not, however, apply to those flights that are coming in to evacuate foreign nationals from the country. It also exempts cargo flights that are coming to the country to deliver goods. They must not, however, have passengers on board. And for these evacuations, let me emphasize one thing. We do not want just to have flights landing at Jomo Kenyatta Airport. We require, as a very firm requirement, that whoever is coming must give us 72 hours notice. So if you have any plans to evacuate your nationals, you must plan, you must give us advance notice of 72 hours at the very least. The issue about cargo flights is very important because you are aware we are very, very, very keen to import and to supply our local facilities with medical supplies and medical equipment. So we require these cargo flights to keep on coming to our country. In fact, as we are talking, we are already planning for Kenya Airways to fly on Wednesday to China to basically collect some key equipment, medical equipment, which will come to help us in the interventions which we have right now. Fellow Kenyans, we are appealing to those in the transport industry to adhere to the directives issued by the Ministry of Health with regard to maintaining hygiene standards in the transport sector. We did say earlier when we started communicating with the Kenyans and the press, that the transport sector is key in terms of transmission. We did say that 90% of our fellow Kenyans, they do use public transport. So this area is critically important if you are going to address the issue of making sure we don't have further transmission of the virus. To this end, we have observed that the said directives are not strictly being adhered to. For example, most matatus are still overloading, hence not observing social distancing. They are also not observing standards of hygiene as per the set standards. Therefore, we have made this decision. From tomorrow, Monday, 6th April 2020, any matatu operator found not observing the set directives will have their SACCO licenses suspended, and the vehicle bonded. This directive applies to all public transport vehicles. The offenders will also be charged in a court of law in line with the Public Health Act for deliberately spreading the virus. And to the border riders who continue to flout the directives already issued, their motorcycles will be impounded and they will face the full force of the law. And for this one, we are working together with the Minister of Interior. The police have been briefed accordingly, and there will be no exemption. We know last time we made this announcement, and the same day you could see borders carrying 3 people. This must be understood very clearly, that from tomorrow, whoever flouts these regulations will have themselves to blame in terms of being locked up by the police and in terms of the vehicles, their equipment being impounded. Finally, the government has also directed that visits to our prisons shall remain suspended for another 30 days. I thank you for your attention.
Questions? Any other? Yes. Last question? The last one?
Yes. There is a question of, I did not hear it. Yes. Thank you very much. I'm Mark from City. Yesterday, a call was made by government to incorporate the youth in the fight against COVID-19. But they are asking who will they consider to protect this year as they go out of the street, and why are they only called upon during elections, 1 and 2 during times of trouble?
Right. I think I'll start with the last question, recognizing that if we look at our country's demographic, the larger population and the larger majority of Kenyans are actually the youth. And I am a testament of being one of the youth who's been accorded this opportunity by the president. What the CES was talking about and what the ministry is urging is that we want to see the youth take personal responsibility. being the large majority of Kenyans within this country, I think we are duty-bound in terms of protecting ourselves, duty-bound in being informed, duty-bound in ensuring we are passing the right messages, and duty-bound in protecting our families, our aunties, our mothers, and our grandparents. So that is a call to the youth. And I must say I was quite pleased just when the call was made, looking on to the reactions from the youth. I could see some people saying that they're going to start some games that actually teach people on how to protect themselves on COVID. And this is what we're talking about, the innovativeness within the youth. Now, the other two questions from Vera Okeyo concerning triage, I'll ask the DG to touch on this, as well as the use of face masks. However, before I invite the DG to come on this, I'd like to say that with face masks, we will be looking at ramping up our communications on how to use face masks. And taking this opportunity, it's important, and I like that the journalist was telling us that you have to wash your hands first before you use these face masks. And if you don't have water available near you, it's important that you try and either use the sanitizers if those are available to you, but generally observe hygiene as you use the mask. The mask has two levels of thread, and I'm going to try and do a quick demonstration just right here for you. You have the top layer and you have the bottom layer. The idea is that the top layer comes out and comes at the top of your ears, and the bottom layer comes to the bottom of your ears. The mask must cover your nose and mouth. I've seen members here even today, I can see masks hanging at the edge of the nose. That's incorrect. It must cover your nose and mouth at the same time. You must open your mask to ensure that the 3-ply area is open and that the dark side of the mask is external to your face. And then when you're removing your mask, it's important that you unthread the mask from the back. You can reuse your mask at least once in a time, but then it's important also to note that this mask, if there's coronavirus around you, then most likely it has come into contact with the mask. So disposal of this mask is quite key. You ensure that you safely dispose it in the same way you would dispose the handkerchief or tissue that you use to blow your nose. Now I'd like to invite the DG to elaborate on triage.
Thank you, CS. I think this question was raised 2-3 days ago, and we agreed that training is ongoing. And because we are modifying the case definition for COVID after every few days based on the information that we receive from WHO and other areas, probably the most likely thing is that you went to a facility where the new guidelines have not reached. So it is our hope that very soon, because we also have to balance the need to be able to train the healthcare workers and also the retrain services to continue. Eventually, everybody will be reached in terms of the guidelines that we have developed so that they can be able to make proper diagnosis and proper treatment protocol. Thank you.
Maybe just one. Not you.
Right, so thank you for that question. Like we remarked today, 9 of our positive cases have actually been identified from the quarantine centers. And what this to us is a testament that the idea of putting in place mandatory quarantine was actually needed and useful to protect the community and to protect our country. What, however, we are doing is ensuring that the maintenance of social distancing and physical distancing within the quarantine centers is strictly adhered to. When we look at this disease and how it evolves as a disease, we're coming to learn that as soon as you're in contact with this positive case, the guidelines and the protocols guide us that we should then implement and institute quarantine for those members who come into contact. These are painful decisions. These are not decisions that we take upon lightly, and we do appreciate the anxiety it has caused. However, I think the DG should come in and elaborate and reiterate further on this issue of quarantine.
Thanks, Madam CS. I think we responded to this issue yesterday regarding the number of cases that we have picked from the quarantine facilities. Again, let me reiterate the fact that almost 54 to 55% of the cases that have turned positive, we have picked them from the quarantine facilities. In certain facilities, people didn't maintain the physical distancing, therefore leading to cross-infection. We want to appreciate, on the other hand, places like Trademark where we tested 144 and all of them tested negative, meaning they respected the covenant of social distancing, they maintained the infection prevention control measures. If you don't, and then in a case, in a quarantine site, you have like MTC where you have 11 cases coming up, then we have no choice but to extend that quarantine period so that we can protect the general population and insist that during these 14 days, again, you maintain that physical distance. You go ahead to maintain infection prevention control measures. We will not, however painful this decision is, we will not waver on the extent of protecting Kenyans just to please a few people who have failed to comply with very simple instructions which other people elsewhere have completely complied with, and very soon they are going home. Thank you. The issue of the cost, I think we have addressed it in our meeting today. We'll see how we'll be able to address it. Thank you.
There is this question of the things that are coming from China. And how do we vouch for their, actually how do they vouch for them? There are some countries that are not accepting